This is a call to action to eliminate cervical cancer. We're losing a woman every 2 minutes, and this should not happen, especially when we have all the weapons we need to fight it. So this is actually a cause that's winnable.
I went for doctor checkup and found out that I have cancer.
I almost didn't engage with it for a while because it felt like I couldn't be a cancer patient at 26. I was so young.
The doctor said she'll call me after a week. She called me and she informed me that I'm diagnosed with the cervical cancer stage 2B.
The most recent data which just came out showed that the current incidence rate is 570,000 women every year. And that we're now hitting 300,000 deaths every year from cervical cancer.
But cervical cancer is indeed both preventable and able to be diagnosed early. And so you see this incredible contrast between countries like Australia, who are set to eliminate cervical cancer as a major health program, versus low-income countries where there's just no effective services at all.
Just imagine that a patient who is just 25 years old all of a sudden presents with bleeding, and you know the patient is going to die.
9 out of every 10 women that die of cervical cancer are from low and middle-income countries.
You are trained to save lives, but most of your patients are dying within 6 months.
It's also an issue of gender and social equity, because we know that the poorest women are most vulnerable.
The doctor read through the results. That's when I was told that I had cervical cancer. I must tell you, that was the worst day of my life, because just to be told that I had a cancer, to me it was almost like a death sentence. It robbed me of all my happiness, all my life. It was just terrible.
64% of women in Zambia live in the rural area, and 80% of the women that are living in the rural area are producers of food. You're going to lose women who can contribute to ensure that this nation is a better nation from a disease that we could have prevented. That is why we need to ensure that this disease is eliminated.
What I think is great about the call to elimination is the targets that they've set. Firstly, to look towards 2030, so a 10-year horizon.
If we can deliver 200 million doses of vaccine in 10 years, we can immunise the whole population over the next 30 or 40 years and reasonably expect that within my children's lifetime we'll have no more cervical cancer.
If we can achieve successful scale-up of HPV cervical screening and vaccination, the estimates suggest that we could prevent up to 13 million cervical cancer cases in the next 50 years.
Cervical cancer can be beaten if we come together. Early detection saves lives, but the message out there is prevention.
We have the vaccines, we have the diagnostics, and we have the treatment. When we have all the weapons at hand, failure should not be an option.